Lascan Corla and colleagues, I'd like to take this opportunity, and I welcome this opportunity, to update the House on the situation regarding COVID in Ireland, as well as the measures being taken to address the threats posed. I'll come to Omicron shortly, but I'd like to start on a more positive note. In spite of the very significant threat posed by the Delta variant, it's clear that the national effort being made over the last number of weeks has been working. The efforts of every single person, every family, every business, it's all been working, and this has been in tandem with a big increase in testing, a big increase in PCR testing, a big increase in antigen testing, a wider rollout and use of the COVID pass, the rollout of flu vaccines, serial testing in nursing homes, and many more measures. And because of all of these measures, but most importantly because of the efforts that people have been making, the number of cases, which had been rising very, very rapidly, has levelled off. And because of the successful rollout of the booster programme, and as importantly the fact that people are looking to get the booster vaccine, we've also seen a steady reduction in hospitalisations, including a steady reduction in the number of people in critical care recently, which is really important. So I just want to acknowledge, in short, that the national effort taken against the Delta variant has been working. Now, what has changed now, of course, is the emergence of the new variant, Omicron. We know it's taking over from the Delta variant quickly. We know it's significantly more transmissible. Just to give colleagues a sense, last week the Omicron variant made up about 1% of all new cases in Ireland. By the weekend, it had gone from 1% to 5%. By Tuesday, we were reporting 14% of new cases were now the Omicron variant, and I can confirm to the House now that as of today, it's 27% of all new cases. So we've gone from 1% to 27% in about a week. We know the variant is spreading rapidly, and yesterday the UK recorded its highest number of cases in one day since the pandemic began. We know it's going to result in an increase in cases very soon here in Ireland as well. The only question is, how high is that increase going to be? The advice I have so far is that the vaccines do provide significant protection against severe illness from Omicron, which is very important, but that they provide less protection against symptomatic infection than they do against the Delta variant, and significantly less protection against becoming symptomatic. The very strong advice I have is that the booster critically provides a dramatic and an essential additional level of protection against Omicron, both in terms of becoming symptomatic and becoming severely ill. And I would urge every single person who is eligible for the booster vaccine to get the booster as a matter of urgency. This is particularly true for people in the high-risk categories, and the groups defined by NIAC are as follows: everyone aged 50 and above, anyone who has an underlying condition, all of our healthcare workers, all of our residents in long-term residential care, and pregnant women. The epidemiological situation, both here and internationally, as well as the emerging evidence in relation to the Omicron variant, is of course being kept under close review. My department, the HSE, the Health Protection Surveillance Centre and the National Virus Reference Laboratory are meeting on a regular basis to review the evolving situation. And as we're all aware, NEFIT is meeting today, right now in fact, to assess the current situation, and government will of course consider any advice and analysis offered by NEFIT. Given the seriousness and the urgency of the threat posed by the Omicron variant, a number of actions have already been swiftly implemented. To protect our healthcare system and our economy, we have responded quickly with new travel measures, which colleagues will be aware of. And as deputies are also aware, the government agreed to introduce a package of new public health measures which took effect from the 7th of December. Really, these were aimed and are aimed at reducing the current levels of socialisation across society to interrupt or indeed slow down the spread of COVID in the community. We're not alone, of course. Many EU countries are introducing new coronavirus restrictions. These include reintroducing measures, some of which we've retained here, such as the use of face masks, COVID certs. Others are having to go further, including, for example, a partial lockdown in the Netherlands and the introduction of stricter measures in Germany. It's fair to say that the situation across the EU remains fluid and it remains uncertain. Our national vaccination programme is, of course, one of the most important tools we have in responding to COVID, and in this case, in responding to the new threat posed by the Omicron variant. We have a very high level of vaccination by international standards. It's something we should be very proud of as a nation. And critically, as well as having one of the highest levels of people vaccinated, we've always prioritised the most vulnerable first, which of course is really, really important. And in fact, if you look at the percentage of those over 50, over 60, over 70 and so forth in Europe, Ireland has the highest levels anywhere in Europe in terms of the higher risk groups being vaccinated, which obviously is very, very welcome and will have and will continue to save a lot of lives and to keep a lot of people safe. We've taken the same approach with the booster programme, of course, prioritising those most at risk first. And a large majority of these groups have now received a booster vaccine. And our aim is that by the end of the year, so within the next 2 weeks, everyone in those groups defined by NIAC will have either had a booster, will have an appointment for a booster, or will have had an opportunity to go and get a booster at a walk-in clinic. We're also doing well on the total number of people who've received the boosters and not just a primary vaccination. Now about 1.4 million people, so about a third of adults in the country. It puts Ireland third in the EU, it puts us 8th in the world in terms of boosters and the number of adults who've received a booster. And I want to take this opportunity to express my sincere thanks to everybody working right across the country, in every one of our constituencies, in every county, who is working night and day to make this vaccine programme such a success. However, as I'm sure colleagues will agree, given the scale of the threat posed by Omicron, given how fast it's moving, and given just how much extra protection these boosters provide, we're going further. Last night I announced a very significant scaling up of the programme to bring us to in excess of 300,000 doses a week on average over the coming weeks. And I would really like to thank our healthcare workers, our GPs, our pharmacists, our servicemen and women in the Defence Forces, and so many others right across the country. We really have put out a national call over the last number of days, and by God, people really have responded. And I want to thank everybody for responding to that call per arms. So capacity is being increased across the board in the vaccine centres, in the GP surgeries and in the pharmacies. The vaccine centres are now going to open 8 to 8, 7 days a week. Additional staff are being deployed. Extra booths are being added where possible. Staff from the Defence Forces are coming in. We're redeploying staff from other parts of the health service as well. We're opening 3 new centres as well, 1 in Cork and 2 in Dublin. While 3/4 of GPs were already involved in the vaccine programme and doing incredibly valuable work, now nearly all of the 1,300 GP clinics across the country have agreed to get involved and to increase their capacity where they have the ability to do so. Obviously, they still have very serious obligations in terms of keeping their patients well on non-COVID issues. The GPs are going to continue to prioritise the NIAC groups. However, as of yesterday, or I guess as of today, they also now have the ability to move through all of their patient groups as the capacity allows. The number of pharmacies has increased immediately from 550 to 700, and we're pushing to get up to 1,000 in the next 2 weeks. And critically for GPs and pharmacies, I approved last night a waiving of the 15-minute post-vaccine wait. This is on a recommendation from NIAC. It's something the GPs and the pharmacists said, if we could waive that, given the context of the urgency we have right now, it will really help them. So that's in place as of today as well. High-risk children will start to be vaccinated next week, initially through the paediatric hospitals and then through the vaccine centres. And on the following week, on the 28th of December, the online portal will open for parents of children who are high risk to register their children, and it'll be self-identification. And the vaccines for this group will start on the 3rd of January. From mid-January, the vaccine centres will open to other children and other adult cohorts. Now, we all know that many parents have a lot of questions, and very comprehensive materials are being put up on the HSE website. Next week as well, those in their 40s will begin to receive appointments for the following week for vaccines to begin. I see, Lasky and Corla, I'm out of time, so I just want to finish by saying it is an urgent situation. I'd like to wish all my colleagues a happy Christmas. I'd like to acknowledge the very broad support politically there has been for the national effort, particularly for the vaccine programme. This is urgent, and I just want to thank all of my colleagues for everything that they have done and continue to do. This is something we really do need to do together. I've no doubt we will, and wish everyone a happy Christmas. Gurmagad.